Welcome to the deep dive. Today, we're looking at something huge. Artificial intelligence in primary care.
Yeah, it's a hot topic. We've got a stack of sources, but we're really leaning on this 2024 paper called Navigating the Doctor-Patient AI Relationship.
Right. And our mission here is to get past the hype and understand what primary care docs, PCPs, actually think. The potential, sure, but also the real-world challenges.
Exactly, because you hear AI pitched as this, silver bullet for burnout, for doctor shortages.
But what's it really like on the ground? For the doctors dealing with it day in, day out. That's what we want to unpack.
Well, this study gives us a good window. It was done in 2023, mixed methods, so surveys and interviews.
Okay.
Yeah, with PCPs and a big health system, Southern California, so pretty grounded insights.
So what was the general feeling? Were they excited, wary?
Generally optimistic, actually. About three-quarters, 76.6%, saw potential in AI for medicine.
Oh, interesting. Higher than I might have guessed.
But, and this is the key thing, their attitude really depended on how AI was being used. It wasn't just a simple yes or no to AI.
Okay. So the specific application mattered a lot.
Totally. The study looked at concrete things, like AI for screening diseases, think obstructive sleep apnea, or helping manage chronic stuff like hypertension, maybe across whole populations.
Makes sense. Practical uses.
And importantly, using AI for admin tasks. Using things like large language models, think ChatGPT, to help draft patient messages, trying to tackle that awful inbox overload.
Back to JAMA time problem, right, where docs are doing admin work late at night.
Exactly that. So optimism there, definitely, about easing that burden.
But I assume it wasn't all positive. What were the main worries? Was it about the tech itself? Like, is it accurate? Is it safe?
Well, yes, those concerns came up. Accuracy, safety, even algorithmic bias.
Yeah.
You had doctors saying things like, I've known a lot of my patients now for 30 years. That can't really be put into a data set that AI can draw upon. That human nuance.
Right, the unquantifiable stuff.
Precisely. But honestly, the bigger concerns, the ones that really dominated the conversation, were less about the tech specs and more about, well, people and processes.
How so?
Workflow and burnout, that was huge. 10 participants actually worried AI could make things worse.
Wait, increase burnout? How?
Yeah, it sounds odd, right? But they talked about needing to constantly double-check the AI's work. One doctor put it really well, saying, it's like having a student with me all the time where I've got to just double-check everything.
Huh. So more oversight, not less work.
Potentially, yeah. And there was this other fear, a big one, that the system would just use AI to justify packing more patients in. We are going to add 2 extra patients per session because now we have help there, focus purely on productivity.
So AI is a tool for efficiency theater, almost not necessarily better care or doctor well-being.
That was definitely a concern, which leads right into the doctor-patient relationship itself.
How did they see AI impacting that? Good, bad, mixed?
Very much a double-edged sword, as the study called it. Some hoped AI could free them up, handle the admin burdens so they could have more focused, maybe more compassionate patient encounters. About 10 doctors felt that way.
Okay, that's the positive spin.
But more doctors, 12 of them, were worried it could actually harm their relationship.
In what ways?
A few things, like AI changing patient expectations. A doctor worried patients may end up feeling that, if the AI can tell me that, then why did I bother to come to you, undermining their role?
I can see that.
Yeah.
Or maybe patients trusting the AI more than the human.
Or bringing in misinformation from, WebMD.GPT, as one participant joked.
Yeah.
And the doctor then has to argue against this powerful AI thing. Another battle, essentially.
So beyond the exam room, were there wider system-level issues they brought up?
Oh, absolutely. A real sense of frustration came through. 9 participants felt there's just not enough focus on physician well-being when these new techs get rolled out.
It's just layered on top of the existing system.
Right. And a major point from 11 participants was about money. The current way we pay for healthcare, it doesn't really reward using AI for innovative care. One doctor said, in essence, we're providing a bunch of free care, which, is not sustainable.
So the financial incentives aren't aligned with using these tools effectively?
Not really. And then there's the equity issue. Big concern there. Who actually gets access to these AI tools?
Will it just widen the gap?
That's the fear. As one participant put it, the people who will get it are the people who can pay for the compute. My biggest fear is that we will leave out the poorest people from getting the best care.
Wow. Okay, so this deep dive really paints a picture. AI in primary care. It's not just about the algorithm. It's deeply about how we choose to use it.
Exactly. It hinges on thinking about the doctor's workload, protecting that crucial patient relationship, and making sure everyone benefits, not just a select few.
It means we need education for doctors and patients, setting realistic expectations, and fundamentally rethinking how primary care even works with these tools, maybe dedicated time for digital health, team-based approaches.
Those non-technical human factors, they seem to be the real key to making AI work for primary care, not against it.
So thinking ahead, as AI keeps evolving in medicine, it really makes you ask,
What are the core values we absolutely must protect to make sure this technology truly serves everyone, the doctors and the patients? That's the big question, isn't it?